this evening. We have a full agenda this evening. First up will be Barry Zimmerman, Ventura County Deputy Director, Ventura County Healthcare Agency, to provide us with an update on the status on vaccinations for our county, followed by Ventura Police Special Operations Commander Darrick Brunk, and then we'll have a short presentation from Caregivers, volunteers assisting the elderly, for our spotlight on volunteers this evening. Our special guest this evening will be Ventura Mayor Sofia Rubalcava. Our last presentation tonight will be Ventura Water General Manager Susan Rungren and Assistant City Manager Akbar Alikhan to speak about the Ventura water, wastewater possible rate hikes and why they are needed. And just some housekeeping. MVCC, since our inception, has always treated everyone at our meetings with dignity and respect, and requires civility to all at our meeting tonight. We will be using the chat function to write your questions you may have for any of the presenters. Chat is a little kind of Q-like looking icon up at the top of the screen, and when you open it up, your questions you're typed down on the bottom. I will be asking the question and ask that you wait until the speaker is finished, and I will start from the last one first and go up the chain, and that way it kind of, some of the questions will be answered as the speaker is speaking, so it's just easier to do it that way. We will take as many questions as time allows for each speaker, and I've asked them to provide their contact information on the chat line to be able for you to follow up on questions you may have that we did not get to. We run our meetings for an hour and a half to be respectful of everyone's valuable time, as many attending may be interested in one subject over another. Okay, and with all that, and then I would like to invite Mr. Barry Zimmerman to go ahead and give us an update on the vaccinations in the county.
Sure, thank you, and thank you for having me join the council. So I will give you a brief overview of where we're at and what's the next stages and so forth, and then answer questions. So first of all, just to give you some numbers, at this time we have issued about 109,000 doses of vaccine to date. We started in mid-December, and so that's what gets us started up to this number. We are currently in these phases of those who are eligible to seek and qualify for an appointment is phase 1A, they call it. That would be the healthcare industry and associated occupations with the healthcare industry. As well, we have just extended and opened to phase 1B, 65 and older. As many of you know, we started prioritizing the tiers first in the age category, focusing on 75 and older first, and then just recently we've opened up to 65 and older. That was a deliberate effort in order to get as many seniors, 75 and older, an opportunity to be vaccinated, since they have the highest fatality rate associated with COVID when they get it. So far, we've vaccinated over 35,000 individuals that were 75 and older. So we have vaccination locations throughout the county. The most prominent one is at the fairgrounds, and that is our largest site right now. We have a location in South Oxnard at Centerpoint Mall, known as the South Oxnard location. We call them pods, which means point of distributions. We have one in Thousand Oaks as well. There is one off of the public health clinic that does special work as well. And we are opening today was an opening for the ones off Rose Avenue, which will be a large site in the Oxnard region. It's in the Babies R Us building that used to be there in that strip mall area. We're also opening another one in the Ventura County Office of Education. They're off Adolfo Road in Camarillo, and that will be open next week. Now, the strategy is that we're expanding our capacity for two reasons. Right now is not because we've received a plethora of vaccines, but we have to have a system that is large enough to accommodate both a volume of first dose and second dose appointments. When we started, our system was solely focused in on first dose appointments, which we did until the time period in which an individual can receive their second dose. Right now, in this month, we are focusing on getting that bubble of those that were in the first round done with their second dose. And so a lot of our concentration are on second dose appointments, and we are limited on our first dose at this time. We hope by the end of February, we will have that bubble done, and then we'll be equalized in the sense that we can schedule both first dose and second dose and have them work through the system simultaneously and not have this up and down strategy. Part of the difficulty that we've had, our entire system can produce a significant number of vaccines or produce another vaccines administered. However, we receive a small allotment from the state on a weekly basis. Anywhere from 10,000 to 12,000 vaccines is our ongoing distribution. Previously, the state did give us first dose vaccines and second dose vaccines, of which we had the second dose vaccine set aside for second doses. A couple of weeks ago, the state changed their strategy and said no longer will you hold first dose or second dose, that you will just get doses and that you manage them based on the need that you have locally. Well, our need is both first dose and second dose, so we work those out on the demand and the appointments that people need. The reason that was critical for us was the state was not keeping pace in giving us adequate second doses that we would need otherwise for those that received their first dose. So there has been a significant limitation in the supply chain. What that means is, due to the supply and the ability to deliver those, so for the month of February, we could only open up about 12,000 appointments for first dose individuals. And we've scheduled close to 43,000 second dose appointments. So we'll be issuing about 55,000 doses for the month of February in total. Our system can do much more than that. It's just a matter of supply. So I'll tell you a little bit of the distribution that occurs throughout the county. So the county health department receives an allocation from the state, and we have what are called partner providers at this time. Some of them are the Vons and the Ralph pharmacies, as well as some of the other clinic systems and health systems in the county that we supply vaccines to. And they administer them according to the policies and where we're at in the phases. There are other systems such as Dignity Health, which is St. John's in Pleasant Valley, Adventist in Simi Valley, as well as Los Robles are known as multi-county entities, and they receive their allocation directly from the state in their system, and they're allocated throughout the entire system. For example, one of the most prominent ones in the state is Kaiser. The Kaiser receives a direct allocation from the state to service Kaiser patients as well as the communities that they're in. We have Kaiser here, but not to the magnitude that it is elsewhere there. So there are other activities going on that aren't necessarily in the purview of the county, nor should it be. I'm not asking for us to control all that, just to let you know that there's multiple things going on. In addition to that, there's what you hear on the news, the federal pharmacy program, that the federal government has contracted with Walgreens, CVS, and in some places Rite Aid, to deliver certain vaccines to a certain population. It started out where they were working in concert with us to vaccinate the seniors, mainly long-term care facilities and skilled nursing facilities. And they continue to do that today. In addition, the federal government has allotted additional vaccines to a pharmacy, CVS in this case, and it's a million doses, and that might sound a lot, but that's allocated over 6,500 pharmacies, which would only turn out to be about 150 doses per pharmacy if they spread it that wide. So to date, the issue, I think our biggest issue is dealing with the supply chain and getting enough capacity there. If we did get enough, if it was unlimited, we could probably double what we're producing right now. So we have a volume that we work 6 days a week right now. We can expand to 7. And we're running about half capacity at each of our locations right now. So we could double our output if we had the vaccines. 2 other things that are complicating the issue, or not complimenting, I'm just gonna tell you how it is. The registration system is cumbersome and not the best. It's not a system we built. It's a system that early on we had to choose from several systems that the state had offered to run these clinics. We call them clinics. It has not been the easiest to schedule them out. It hasn't been easy for people to navigate through them. We apologize for that, but we're trying to make the best workarounds as possible that we can make that somewhat user-friendly. We have set up a phone bank for people to call, and that demand has been very high. Originally, we communicated out that the phone bank was set up to help register those that otherwise would not have internet access, but found that a lot of people just would call no matter where, trying to get access to a vaccine, which is understandable. We are working with the state now is going to convert our registration system to a new platform known as My Turn, and that will become the new registration system uniformly throughout the state. We don't know exactly how that looks. We haven't been able to see or work with it at this point, but we do know that we're considered a Wave 2 county, which means in March 7th, we'll be converting over to this new application and a third-party administrator that will distribute the vaccines to the county. So right now that we work directly with the state, and the state has contracted with Blue Shield to be a third-party administrator to administer the vaccines not only to us, but to all providers in the county that are authorized to issue vaccines. And so that's probably more than you'd want to know of what we're doing. But I think the message that we're putting out is that we recognize that appointments are limited, and even so, rightly so, that we're fully scheduled through the month of February at this time, and we are waiting for more vaccines to open that up in a wider opportunity for individuals. We do have plans to expand even further into the Santa Clara Valley. We also have mobile teams that we've built. We have 6 of them so far, and we're going to go up to about 15 mobile teams to work with the ag industry, as well as we have to cover some long-term care facilities that the federal government is not taking care of. And we're working for homebound seniors and identifying them to get to their homes as well. So that's kind of a shotgun approach. I'll probably best to entertain questions at this time if you would like.
Thank you. No, that was a lot of great information. It wasn't cumbersome at all. It was great to hear all that's what's going on up to date. So there was one question, I think you may have answered it, about partially protecting people with the first dose instead of delaying the second, and are you considering that? Is Ventura County considering that?
So we are following the current guidelines with the CDC is to follow the protocols with a first dose, second dose strategy, and we're continuing with that strategy. So I'll tell you, there is some tolerance associated with it. So if you have the Pfizer vaccine, your second dose is to be scheduled after 21 days. And it says no sooner than 21 days is the guidance. If it's a Moderna vaccine right now, that's a 28-day wait period. We recognize that not all the appointments and so forth can happen on the precise date. So there's some tolerance there. The guidelines is right now that it's up to 6 weeks after your first dose is your window to get your second dose. So meaning, like if it's Pfizer, you really have a 3-week window after that 21st day and a 2-week window after the 28th day for Moderna. We have offered those appointments to people who have had their first dose. We send out a direct link, an email, a contact, if we will, the best we have, to individuals who have already had their first dose about a week before they're eligible to sign up for their second dose. And then they can follow that link and pick an appointment within usually a 2-week period there. I'll tell you, there is, if it goes 3 weeks, it's not going to dramatic that much, but we are trying to stick with that protocol as best we can. There's other countries that have gone to a first dose strategy where they'll just issue first doses and work 6 to 8 weeks or more before the second dose is administered. We have not followed that protocol now.
And I would think the percentage of people that are getting that second dose once you notify them is pretty high.
Yeah, so at the fairgrounds earlier this week, so the fairgrounds used to be a first dose site. We have converted that over to second dose appointments only for both vaccines in order to get the higher volume through to equalize out our appointment schedules. We had about a 97% show rate the first couple of days this week there. So yes, the majority do come in as they sign up for appointments. It's surprising though, we had only about a 70% show rate of first dose appointments, which is surprising since the demand's so high. There's a couple theories for that if you want to know. Some of it is people were making multiple appointments. We do know that occasionally, things happen and people can't make it, and we recognize that. Some people have then speculated, well, if you have no show rate, you have extra vaccines laying around, and that's not the case. So we see on the news in several places where people line up for what they call last day doses there. We have spent considerable amount of time. We have lead public health nurses at each of our sites, and towards the last half of the day, we manage vaccines based on appointments coming in. So that means that we narrow the window of vaccines that have been made available in a shot in order to prevent any spoilage at the end of the day. My last week's report, 4 out of the last 5 days at the fairgrounds, we had 0 leftover doses. And when we did have a leftover doses, it was 1 or 2, and thereby we can vaccinate others like the security guards or whatever that are on site and take care of that. We don't recommend that people line up and hope to get those 1 or 2 doses, but our strategy is not to prepare vaccines that otherwise we don't have appointments for. This allows us, if we do have a few no-shows happening, it does collect, and we're able then to expand and open appointments. So within a 7-day period, all vaccines and appointments will be used up. The time frame is, there is a logistical issue, so just on the scientific basis of the vaccines, there is a life cycle to them. As you heard, the Pfizer is on an ultra low freezer, negative 80 Celsius is what it needs to be stored at in the solid state. We have freezers like that. We've notified the state early on in December. We acquired a number of those freezers and a redundancy system to store Pfizer, thinking that Pfizer was the premier vaccine, and it would be a matter of those who could store it the best. So we could store up to 200,000 doses of Pfizer today if we had the ability to acquire it. Pfizer, once it's thawed or becomes a liquid state, we have 5 days to use it. And then once the vial is punctured with a shot and prepared a shot, it's a 3-hour window. And usually it's 5 to 7, depending on, we really average 6 doses out of a vial. And so it's 6 doses within a 3-hour window. So we can manage it pretty closely. Moderna is much more stable in the sense it doesn't have so volatile temperatures. It's still in a solid state, but just at normal freezing level. And then refrigerated state on a liquid can keep it for 30 days. It does have a 6-hour window associated with once you start using it out of the vial. So both have to be used with caution in the sense that we manage them carefully.
Well, Barry, I want to thank you very much for being here. I have to tell you on a personal note, as a member of the Fair Board, I'm happy to see it being used so effectively for both testing and vaccinations. And hopefully maybe later this year, we might be able to open it to the public in general use again. But anyway, thank you very much.
I would welcome that. Thank you for having me. I'll be back anytime. Thanks.
Thank you, sir. All right, up next, we have Commander Darrick Brunk, and he's going to give us a little information and update about, well, what's going on in the city around us, I guess.
So I will go over I know you guys are time strapped, so what I'll do is I'll go over the crime stats for basically the Midtown area, and then talk a little bit about the end of the year stats that we just sent out and published. So in the Midtown area, we had 17 thefts that occurred. This is between January 10th until February 7th. I'm sorry. Vehicle burglaries, we actually had 11, which is kind of high for that area. Motor vehicle thefts, we had 6. Commercial burglaries, we had 6. Aggravated assaults, and actually all 3 of these ended up being domestic disturbance calls that we went on. We had 3. We had 1 robbery that included a gun that occurred at the mall. We had 1 arson that was basically a dumpster fire set off by a transient. And then we had 1 residential burg. So that's the crime stats for just the last month. A couple days ago, we also released the crime stats for last year. We were all we had kind of an idea what was going to happen, but the numbers were actually pretty interesting. Overall, for Part 1 crimes, which are what the crimes that we have to report to the FBI, for the violent offenses, that would include homicide, rape, robbery, aggravated assaults. For property crimes, it includes burglary, larceny, motor vehicle thefts, and arson. So we were up 0.3% on all Part 1 crimes last year. So we had a total of 3,446 crimes. And like I said, that was 12 offenses more than the year before. We saw a significant decrease in violent crime, about 28% lower than the year before. And then we saw a higher rate of property crime, about 4.77%, which the highest increase of that was from our commercial burglaries. The reason, and what we can tell from the stats, the changes of this, COVID had a big impact on this. People were not out. So for most of the year, or I'm sorry, for 4 months of the year, we really saw very few assaults, very few violent type crimes. Going back to the property part of it, though, what we did see is a very significant increase in commercial burglaries. People were not in their businesses, and we saw almost a 60% increase in commercial burglary. So where residential burglary is actually down, and that was mostly because people are home. So those were the 2 stats, or the 2 things I wanted to share with you guys tonight. I can answer any questions now, or if you guys would like to ask me questions later, because I know you have a very long agenda, and Mayor Rubalcava has got her opportunity here to speak too. So I'll either take questions, or you can get a hold of me later, and I'll leave my information on the side, however you want to go.
That would be great to leave your information on the side, Darrick. There is one question, and you are with the police department, but there's a question. Do you know anything about the house fire on Channel Drive? Do you know what caused it?
I do not.
Well,
sorry.
All right. Well, thank you very much. I don't see any other questions right now, but if you have if someone has something that's more personal, they can certainly contact you as well.
Always contact me direct. I'll answer the phone anytime.
Thank you very much, sir. Appreciate it.
Have a good evening.
Thank you. And next we're bringing back our spotlight on volunteers, and it's kind of like a long elevator speech about different organizations. And Tammy Glenn, who is with Caregivers, Volunteers Assisting the Elderly, is our speaker tonight. So Tammy, take it away.
Well, thank you. I'm really delighted to have the opportunity to speak to all of you. I love talking about what we do here at Volunteer Caregiving, and I want to thank all of you for your support of caregivers in Ventura County and Ventura. Gosh, I really learned the value of volunteer caregiving in March. We were really on the front line, and Kelly Brown over at 211 had given us a call and said they were getting 3,000 calls a day, and she said, "Help! These are your people." So we jumped in. We weren't really sure, if we were going to be able to do this. A lot of our volunteers are over the age of 65. Recent retirees who, are still active in the community. And anyway, we made a lot of decisions over the course of a few days, and we actually automated a lot of our volunteer activities. We built an online system in the course of 3 days, which is now being picked up by other volunteer caregiving organizations from Hawaii to New England to Texas, all over the country, which is really, it's been an extraordinary year in that regard. We jumped in to help with grocery shopping, pharmaceutical pickup, critical medical rides, things that we always have done, but we just retooled a little bit for COVID. Instead of the senior going with the volunteer, our volunteers jumped in and did the shopping and either dropped on the front porch, or if the senior couldn't lift the groceries, they'd carry them in and drop them on the kitchen counter and then go. And we, added a lot more safety measures in. We doubled the number of seniors, and fortunately, we were able to double the volunteer base, which is one of the ways that we pulled this off this last year. My office team, I have to give them a lot of credit, and the board for everything that happened. But volunteer caregiving is neighborly deeds. We're not personal care, toileting or bathing or wound care. We are a helping hand for independent activities of daily living. And we have a wonderful student volunteer program, which has been a little bit of a roller coaster ride this year, depending upon whether we were on a lockdown or not. But the students go in and they usually help with household chores, change the bed sheets, run the vacuum cleaner, dust. They do a lot of yard work for our folks. The couple things that I wanted to mention, in addition to the regular things that we do, we have a hospital to homecoming program that's been very successful now the last few years. We also launched a dementia-friendly relief program, which we're finding to be in greater demand since people have been so isolated. I think family members or friends are noticing patterns with dementia and really seeking support on that level. On the COVID front, we're getting ready to roll out a vaccine buddy program. So Mr. Zimmerman was talking about navigating the immunization program, and then not only getting the appointment and navigating that scheduling, but then getting the transportation to 2 rides for homebound seniors. That's a huge obstacle, and I think volunteer caregiving can, really play a heavy role in making sure that happens. I moved some of our roses in as we were setting up. We've been busy here, so I look a little disheveled because it's been a hectic day, but we're going to be delivering 60 roses tomorrow all over the county. Heavy in Ventura. Ventura is still the largest community that we serve. It's where we started, and it represents about 40% of our senior base. And what else can I share with you? I guess I'll probably close it up there and take some questions. Whoops, Dan, I can't hear you.
Tammy, I forgot to mention that you are the executive director of Caregivers. And
don't tell anybody.
And I also did. I don't see any questions yet. But you put your information on there if people want to become involved, to volunteer to help you, or? And I know you were one of the 5 organizations that our council made a donation to this holiday season, because we couldn't really get out there and do much. We didn't think that there was much we could have done at that time. But so thank you for that, for doing what you do in our community.
We're grateful. Caregivers it operates on donor dollars. We don't take a lot of very, very minimal support from the cities of Ventura, Oxnard, Thousand Oaks, and Camarillo when it's available. But for the most part, we operate solely on donor dollars. And yeah, it's a great project. Our golf tournament's coming up. We'd love to see you all send a foursome if you want to join us March 19th. That tournament's been going on for 29 years this year. So, and you may, some of you may recall Norm Weitzel, who started that tournament. He was the co-founder of that tournament.
And yeah, your website is up there as well. So I don't see any direct questions, but I learned a lot tonight. I didn't know that you did quite everything that you do. So, and I know Christine Burke, I think, had referred you as one of the organizations that we should, you know, do something with. So it was nice to be able to have you here this evening.
Thank you so much. I've got to be up early for roses. So have a great evening, everybody. And thank you very much for your support. Thanks for having us. Seniors over 60, volunteers from 16 on up. We'll take them.
Thank you very much.
Have a great night.
Thank you. And I did just want to acknowledge that we also have council persons Doug Halter and Mike Johnson here with us this evening. So thank you for being here. And there's Doug. And now our special guest this evening is our new mayor, not too new, but new enough that, and we just wanted to really appreciate you being here tonight to just give us a little bit of background of who you are, so people outside of your original district can get to know you a little bit better. So please go ahead.
Yeah, absolutely. Thank you, Dan. And I am pretty new. I've only been on the job for about a month or so, so pretty new to the mayorship. Well, like Dan said, my name is Sofia Rubalcava. I was appointed as mayor by my colleagues back in December, so I'm pretty new at this role, but I'm really enjoying working with my colleagues. I've always said that, you know, I really enjoy on anything that I do. I like to work with other people as a team. So I think we have a pretty good team here. We have 3 new council members, and I think we're really finding our stride working as a team. Because really we're all interested in, you know, improving the city of Ventura. So the more we can work as a team, the better. And I would extend that invitation, not just to my colleagues on the council, but to all other organizations and agencies in the city and in the county. Because I really think that a lot of our biggest issues in the city of Ventura are not just city issues. They really bring in a lot of other agencies that can help at different levels. So yeah, just an invitation. I know that we have some school board members here. We have Matt Almaraz, a school board member, vice chair for the school district board of education. So, and like we had like the county present earlier. So just working together with all of our agencies, our local agencies and organizations. So I'm open to questions if you all want to perhaps put some of those questions in the chat, and I can kind of look through them and see how many we can get to. And also, Dan, I want to be really respectful of the time that you have here. So you let me know when we're running low on time.
We have plenty of time for you.
Okay, sounds good. Okay, let's see. We'll start taking some questions. I'll just tell you a little bit about myself first.
Yeah.
So I was born and raised on the west side, on the Avenue of Ventura. And so I went to the local schools. I actually went to Will Rogers Elementary School for kindergarten through 3rd grade. And then after that, I transferred over to Sheridan White Elementary. For middle school, I went to De Anza Middle School, and then I went to Ventura High School, and then I went to Ventura College, and then I went to an interpreting school in Los Angeles. And then after that, I transferred to UCSB, and I got my bachelor's there. and I currently work for a neighboring school district. I'm a translator and interpreter. So I am in the communications department, and that's why I really value education and communication, because I know that the difference that it makes. I've been working for the school district for about 10 years now. And before that, I was working for Ventura Unified School District. And let's see. We have some questions. How's the city's budget looking? That's a really good question. I think right now, because of the pandemic, all of our budgets have been suffering. So luckily we were able to make some cuts where appropriate last year so that we could balance the budget. So this year we're looking at about a deficit of $3 million. And it sounds like a lot, and it is a lot, but we're looking at ways to maximize the funding that we do have. And so it's all about shifting the funding, right? As I think many of us have had to do during the pandemic. I think a lot of people have been affected with their own jobs, their own finances. So it's all a matter of shifting our budgets around. And, you know, fortunately, there's possibility of us receiving some funding to help. In the past year or so, we haven't received a whole lot of funding from the federal government, but there's a possibility of that happening this year, so that can help. So the city budget is always a challenge, but we as a team will do the best that we can to really shift around the resources and make sure that we don't cut a whole lot of the vital services that our city provides. But that's a really good question. And we will have a budget workshop coming up. So in the next couple of months or so, so you will be seeing a lot more information about the budget. Let's see what else.
I see Matt Alvarez from the school board. He's excited to see you here. And I see our administrator, former star reporter, has a few more questions. So Greg's asking, is the city plan to look at future use of the Pacific View Mall?
Yeah, absolutely. You know, I think that's been an issue that we've been talking about for the past few years, actually. So I think the general plan update process will be a really good time to talk about the Pacific View Mall and what are some of the possibilities that we can envision for that location. So yeah, I would also like to invite all of you to the general plan update workshops. Those are coming up. And I think maybe we can put some of those dates in the chat if we have our team members who can put some of those to invite the public.
And I see Derek Towers is wanting you to hear a little bit about your vision for Ventura in the next 10 years.
Yeah, absolutely. So let me just tell you why I actually got involved in city council and city politics and city government. When we moved to districts, our district here on the west side hadn't really been represented. We didn't have a council member that lived on the west side. So a lot of the west side residents were really wanting to have representation because there's a lot of needs on the west side. Of course, there's needs all over the city, but we on the west side have certain needs that a lot of residents felt like hadn't been addressed. So when we moved to districts, a few people here in the community were looking for someone who could represent the district. And so people approached me and asked me if I would run. And at first I thought, well, I didn't see myself doing that just because we never had a representative. So there wasn't really someone that we kind of looked to do that work here on the west side. And that's why I think, you know, representation is important, because unless you see yourself reflected in your representatives and your leaders, you might not see yourself in those positions because you don't see anybody that maybe is from the same area as you or that looks like you. So that's why I do think that representation is very important. And so after giving it some thought, after talking to a lot of community members and to my family, to my coworkers, to my boss, et cetera, I decided that I would go for it. I would see if that was a possibility. So luckily, I had a lot of support from a lot of the residents here who really wanted to see positive changes, not just for our own neighborhood, but for the whole city. So I think one of the things that I really value is connection, like being able to connect with your city and being able to connect with your organizations. And I think some people feel like they don't belong or they're not connected to it. So that's one of the things that I would love to improve. I know that our city has in the past lacked communication and connection to our residents, but I think we're heading down the right direction. We have a new communications department, and I know that we have a couple of our team members here. I see Haley and Heather. So I think they're doing a really good job promoting more communication. It's better to over communicate than to under communicate, because when we under communicate, people start filling in the gaps with their own stories or things that they have heard from others. So I think it's really important for us to put out the accurate information so that people can begin to connect more and have accurate information. So let's see, some of the, what I would love to see in the next 10 years is having more opportunities for people to have great quality of life. That's what I think we all deserve, regardless of what part of town you live in, regardless of your zip code, regardless of who you are, regardless of your gender, your age, etc. I think my goal is to make sure that we have an equal opportunity for a great quality of life for all residents. And that would, personally, that would include a lot more opportunities for us to be active in our community, to participate, to move around freely in our community in a safe manner. And that would include, opportunities for people to have a good job, to be able to go to good schools, to be able to move around freely, to be healthy, and really promoting that well-being. I think here in Ventura, we have a lot of really good opportunities for people to get out and about and have really healthy lives. But sometimes some communities don't have the access to be able to access those things. For example, one of the things that has come up quite a bit for me in my neighborhood is having access to the beach. And not that we don't have access, because anybody can go to the beach. Anybody can go and swim in the ocean. But that becomes an issue when people don't know how to swim. And that's one of the things that I would love for us to be able to do, to get more residents in our community to learn the skills that they need so that they can have access to our great natural resources that we have here in the city of Ventura. We also have some great hiking paths, for example, but not everybody can access those paths unless they have a car. So looking at ways of making all of these wonderful natural resources that we have more accessible to all residents. Let's see, let's look at some of the other questions.
I do see that Kate Faulkner had a question about water, but I think we'll wait for the next speaker to talk about that.
Yeah,
Christine,
we have water experts here, so let's wait for them to give
them answer that. And Christine Burke, how do you see our community coming together to foster more community togetherness, and what kinds of new forms of government has the pandemic spurred?
Yeah, well, one really good example is, I mean, look at your attendance here tonight. You've always had good attendance at your meetings, but I know that the pandemic has forced us to take all of this online, to take it virtual. And because of that, I see that there's more attendance, even at our own city council meetings. A lot of people tune in for the council meetings because now it's easier. Rather than having to drive down to City Hall, people can just log in. You know, they can be cooking dinner, or they could be eating dinner, or doing something else while listening to the meeting. So I think the pandemic has really opened up new ways for people to get involved. So one of the ways is doing things virtually. for those who are able to connect. So I foresee in the future having a hybrid combination of doing things in person, but also having these options to do things virtually and remotely so that more people can participate. Let's see, and some of the ways to bring in people. I mean, I think the first step is communicating the information to get people interested. And so I know that our communications team at the city has been putting out videos and things that allow us to digest the information in a different manner. I mean, they put out things that we can read, things that we can watch, things that we can hear. So just digesting the information in many different ways. And in the future, I would love to see more tours, for example. And I know that that's something that the water department has been doing. They give tours to students and to adults. And I think for us to really understand how things work, it's important for us to see it in person and really see the mechanics of how things are working. So I think that's going to be key once we're able to go back in person, to allow people to come in and see things for themselves. And not just for the water department, but for all departments. I think it would be great down the road when we can reopen City Hall to bring people into City Hall, give them tours, like historic tours, art tours. And I know that there's been some of that, but I think we need to do more. I think if people come into City Hall, it's a beautiful building and there's so much history, and it's just really interesting, the history of City Hall. But a lot of people, even in our own city, don't know about it. So I think it would be great to bring people in and teach them about the history of City Hall and some of the really, I mean, I hear that there's ghosts at City Hall. So even, making that a selling point for students, for example. I mean, wouldn't students be interested in, really hearing the stories about the ghosts and doing all of that? I mean, I think they definitely would. So just finding all of the different ways to bring people in. And once we bring them into City Hall, because we're telling them ghost stories, we can then show them, this is the water, this is the where you pay your water bill. This is the city attorney's office. This is the place you go where you want when you want to get permits to replace your windows. Once we have them in the building, teaching them about all of the things that happen in that building and all of the services that sometimes we don't connect to the building itself. Like water, for example, we all get our water from Ventura Water, but sometimes we don't connect that service, that vital service, to our city. So just making sure that people have the opportunity to learn about all that. And I always say, start them young. I would love to see more students in classrooms learn about city government so that they can get involved early. And perhaps we could even start recruiting future employees, future local employees from our own schools. So that would be one of the other things. Once we're able to go back, I would love to see those types of things happening. Let's see.
Darrick Brunk looks like he has an interesting question there. How do you think Ventura will be different post-COVID, and what from pre-COVID do you hope to preserve? You kind of hit on that a little bit, but
yeah, I think COVID has exposed a lot of things that some of us maybe knew about before, but now with COVID, they've been exposed. They're now out in the open. COVID has exposed some inequities in how things work. And I'm not just talking about the city, but just, in everything, in different aspects. I mean, I work in education, so COVID has exposed things in education that we kind of knew about, but now we have no choice but to actually recognize it because it's right before our eyes. So I think some of the things that COVID has done is it has exposed a lot of the issues in our community. So now we're forced to acknowledge them and to address them. And how will things be different post-COVID? Like I said, I think going virtual, COVID has forced us to go virtual. So I think that will actually remain. There will be a piece of that will remain going forward. And what from pre-COVID do you hope to preserve? Pre-COVID, I think the thing that was really good about pre-COVID is valuing those connections that we can make in person. I mean, I think that's one of the things that we all miss the most, being able to connect with people in person. So I know that I will not only preserve that, but I will value it even more going forward. So I think really providing those opportunities for people to connect in person is going to be key to our success. So it's interesting that one of the things that we're going to keep is going virtual, but one of the things that we're going to value and preserve is being in person. So that combination of those two things, I think, will be important.
And Karen Flock is just very thanking you for all that you do. And Bobby Grantham is looking forward to working with you. And I'm not sure what Bobby does, but
whatever Bobby does, we welcome your collaboration. Honestly, we need collaboration in many different fields and many different areas. So Bobby, whatever you are able to contribute, we will take. And that's the other thing, that sometimes we think that we need to have certain skills or we need to be a certain kind of person to be able to provide something, to contribute to something. But I think we all have strengths that can be very useful to what we want to do in the city. So anything that you can provide, that you can contribute, trust me, we can use it and we will take it. Let's see. Another question about, do you see Main Street closed in downtown for the long term? So this Monday, we just looked at extending the Main Street moves permit. And so it will be extended until January the 7th, so that we have all of this time to continue providing the businesses the opportunity to have tables outside and serve people and welcome people to downtown. And so that is extended for the rest of the year. And long term, you know, I think it'll really be up to the community. If the community wants to see this long term, then we will hear about it for sure. And so I really kind of put it back on all of you. What do you guys think? Do you want it to be a long-term project or not? So I think it's been, yeah.
I'm sorry, did you say January 7th? You're extending it to next year.
Yeah, till next year. So we'll have a whole year to continue to see the benefits and some of the challenges as well. And so that will give us all time to really look at, you know, pros and cons, and do the pros outweigh the cons. So far, it's been a good project. I know that there's been challenges as well, so we need to address those things. But so far, it's provided an opportunity for our businesses to be able to serve people outside, but it's also provided an opportunity for our community members looking for a little bit more of that in-person connection to have a safe place to be able to go. You know, we're asking people to wear their masks and follow the protocols and be safe, but still just being around other people, even if you're 6 feet away, is good for our community. It's a healthy thing to be able to go and be around people, even if we are socially distanced. So far, it's good.
Madam Mayor, I think we need to go ahead and move on. All of us really appreciate you being here tonight and sharing some of your vision and how you got into running for City Council to begin with. And thank you very much for your time this evening.
Thank you, Dan, and thank you everybody for the invitation. I really enjoyed my time with you and getting some of your questions. I'll put my email in the chat box so that if you have additional questions or if you want to connect, you can do so. Thank you, everybody.
Thank you. And up next, we now have Susan Rungren, Ventura Water General Manager, and Assistant City Manager Akbar Alikhan to speak about the Ventura Water Wastewater possible rate hikes and why they are needed. And so I don't know if you guys have a PowerPoint or whether you're just speaking. I'm not sure if Greg's got, if you need to have our administrator share, should be able to have you share the screen.
Yeah, Dan,
Sorry, Susan, go ahead.
I was just going to say, Dan, yes, Akbar's got a presentation that we're going to pull up here.
and I might need some privileges to go along with that. I'm not familiar with GoToMeeting, but I'll do my best. Does someone need to confer some privileges to me?
Yeah, I'm going to get it to you right now. So hang on just a second.
Thanks, Greg.
And while we're waiting for that to get up, I do want to give a little shout out here to Jim Ackerman, who's one of our current water commissioners. And I see that Don Mills, I think, is on here too. And Don was on the Water Commission for several terms. So appreciate you both being on here tonight, and everyone else too. Looks like Akbar is getting this up. So I'll go ahead and just get right into it. We really want to thank you for having us here tonight. We want to give you an overview of Ventura water and wastewater rates. As Dan mentioned, I'm Susan Rungren, General Manager of Ventura Water, and Akbar Alikhan is here tonight, the Assistant City Manager. He's been working with us on the rates and really appreciate his help on that. One of the things that we've been doing is working with our Water Commission, and so they are going to give a recommendation to Council. And so we're going to go through some background and give you an update on what's happening in the timetable. Next slide, please. So a little bit about Ventura Water, and one of the things that you may not know is we have over 100 employees, staff members just in Ventura Water itself. We do water, wastewater, and recycled water. We have the billing system, customer care. We have a full service lab. We have operations for water and wastewater, and again, recycled water. A little bit about our existing water system. We serve customers within the city limits, but also within the sphere of influence. So we go up as far as North Ventura Avenue and also in the Sataquay area. So our existing water system, we have 3 treatment plants, several miles of pipeline, pump station, wells, and tanks. Next slide. Our existing wastewater system, we have 1 wastewater main system treatment facility down by the harbor, several miles of pipeline, and about 11 lift stations and around 7,000 manholes. Next slide. I'm going to go through these kind of quickly because I want you to be able to hear Akbar for the meat of the presentation. Some of the things that we've been going through here. So we have a multi-step process when we look at our rates. Our system needs evaluation. We look at our future water supply and we look at our demands. We have water quality impacts that we need to look at. We look at changing conditions, our financing. So it really takes a huge team. It's all of our departments, and especially the city manager's office, our finance department, and our public works and Ventura Water department. We have our critical projects identified in our capital improvement plan that, again, we work with other departments, especially public works. And every 5 years or so, we look at a rate study. The Water Commission recommends rate changes to City Council for approval. And so we've been going through that for the last several months. Next slide. So one of the things that we look at is, what do we need to do for investing in our water and wastewater future? We need to secure our water supply. We need to improve our water quality. We have to meet our regulatory, and we have some legal requirements also. And if you don't know, we have to repair and replace our aging infrastructure. Many of our facilities and pipelines are over 60 years old. Next slide. So to get to the rate decisions, it requires effective collaboration. And so again, we've been working with our Water Commission and our financial analysts the last several months. We've had several Water Commission meetings, which some of you might have attended. We're going to community council meetings like the one we're having tonight. So at the bottom of the slide here, you can see there's several events that we're going to be talking about. So if you'd like to go to those also and attend those, that would be great. And again, one of the next big steps we're going to have is going to council with the Water Commission recommendation on March 22nd. Next slide. So with all of this, we have continued communications and outreach. Haley has put a few things on the chat for some videos that we have. We do a lot of social media, mailers. We have public polling and surveys that are ongoing. And if you ever have any questions or concerns, feel free to reach out to us on our website, and we'll put some emails in the chat also. Next slide. So kind of went back quickly through the background and efforts to date. And now Akbar is going to go through the rate changes ahead. So go ahead, Akbar.
Thanks, Susan. And thank you for having both of us. This is kind of the meat of the presentation, and there's a little bit more for Susan to cover after I'm done. As Susan said, we do a rate study, ideally every 5 years, and the reason we do that is we take inventory of what our quality and supply is, ensure that we're meeting all the regulatory requirements. We develop a capital improvement program to see what infrastructure repairs need to be made. And we do that with financial stability in mind for both the water enterprise and the wastewater enterprise. Of course, we want to keep water affordable, even for our lowest income residents. And the last thing we do is we take a look at this thing called equity. That means, are we appropriately charging different types of customers, such as residential, commercial, industrial, and irrigation, what they ought to be charged to convey service to them. This is a chart of our peer agencies and where Ventura stands relative to them. We are third from the left, third from the bottom, that is. This is a comparison of the average single-family detached user for the average home. That's $89.95 per month. And as most of you know, we don't pay a monthly bill. We pay a bi-monthly bill here in Ventura, but that will change this coming July, and Susan will talk about that in a minute. We put these on monthly terms for the sake of comparison, because what I want to illustrate on this slide is that we are near the bottom. We had started a rate study just prior to the Thomas fire, and that effort got derailed because of the response effort. So we haven't raised rates in all of calendar year 2018, 2019, and 2020. We've gone 3 calendar years without touching rates, and that's good in a sense because it's kept rates affordable. It's bad in a sense because we are a little bit behind, and we have major investments that need to be made, and Susan will talk more about that. One thing I want to point out on this slide is that same home paying $89.95 per month, the average home, that same home in the city of Oxnard, just to the east, would pay $103 today, $13 more. If I get across nothing else in our presentation, I hope it's just this slide, because this really spells it out nicely. The Water Commission has recommended to City Council, after many months of working in tandem with staff and our financial rate consultants, a 7% increase for water every year for 5 years, and a 6% increase in wastewater service every year for 5 years. And what that translates to, again, using that average user, average homeowner, that pays $90 essentially today, that would translate into a monthly increase of $7.76 per month going on for the next 5 years. And I'm going to illustrate that a little further on the next slide. So again, using that average household of $90 for what they pay today, that same household, once the first year of revenue adjustments or rate increases are put into effect in July of this calendar year in 2021, that same household would pay $100 starting in July. And I know the first observation you might have is, well, hey, Akbar, that's more than $7.75. That is in fact $10 from $89.95 to 103 cents. I want to point out that the 776, is an average over the course of 5 years. So let me go forward one more year from July of 2021 to July of 2022. Notice that's only going up by $6.50. So again, that $7.76 increase per month is an average across the entirety of the 5 years. I was about to say next slide, then I realized I was in control of it. I want to fast forward now to what rates may look like in the year 2025. If you remember a couple slides back, Ventura was close to the bottom end of this. We were third from the end. And a common comment or fear I've heard often is, well, once we're done doing these rather substantial rate increases, we're going to be all the way near the high end. We're going to be next to Santa Barbara. We actually did the math here, and this is what it showed. We're not going to be next to Santa Barbara. In fact, we're going to be middle of the pack. And what we assumed for everybody else not named Ventura on this list is a very modest increase of 3.5% per year. We know for a fact there are several agencies on this list that are going to increase more than 3.5%, but we assumed something very conservative just for the sake of comparison. And what we found is Ventura ends up dead smack in the middle. We have 6 agencies to our left and 6 agencies to our right. But the other thing I want to spell out, I'm going to take on Simi Valley for a second, because I want to really drive home what Ventura residents are getting for that increase. Simi Valley relies in large part on imported water. They are close to us on this graph. It's essentially the same price if you're a resident in Simi or Ventura in the year 2025 based on these assumptions. But what are we getting for that? We're getting better quality water than we have today. And perhaps most importantly, we're getting drought resilient or drought proof source of water through the Ventura Water Pure program. And Susan will talk about that in a minute. And another way of thinking about this is today we pay for lower quality water in other ways, whether that be through your bottled water that you might buy from the store, or through a Sparklet subscription you might have delivered to your home, or a water softener. Come later in the future, when Ventura Water Pure is constructed and state water, we have a connection established, and we have those new sources of water on board, it would be fair for a resident to evaluate whether they want to keep some of those, for example, the Sparklet subscription. Is that something you want to continue if water quality were improved? So I want to plant that seed today, and of course we'll revisit it as time goes on. But I simply wanted to illustrate that we are paying. There are other benefits that are conferred upon us going in the future as we make reinvestments back into our system. So aside from residential bills, this rate increase will affect non-residential customers as well. And some of you are, I'm sure, business owners or work for local businesses, and that's why I really want to share this slide for. There's 3 examples on the screen. I'm going to start at the bottom left. Take, for example, a small retail. This might be a boutique clothing store of some sort. That's maybe 1,000 square feet, using only 4 units of water per month. Maybe they have a bathroom on site or a small kitchenette, and they have a 1-inch meter. Today, that business pays about $41 per month. After these proposed rate adjustments, that same business would pay about $5.70 more come July of 2021. Moving to the middle column, say take a multifamily residential building with 10 apartment units in it. A building that size might use 40 units of water per month, 40 HCF. You'll see that abbreviation throughout this presentation. HCF stands for 100 cubic feet, and that's equal to 748 gallons. I know it's an odd number, but that is what's commonly used in the industry. So take that building, for example, using a 2-inch meter. Collectively, not per apartment, but collectively, that apartment would pay $187 per month today. That building's bill would go up by $26 come July of 2021. And then lastly, all the way to the right, take a medium-sized restaurant, 1,500 square feet, using 40 units of water per month on a 2-inch meter. Today, they pay $232. Come July, that would go up roughly 10% to $27, by $27. You can actually go online tonight, in fact, and calculate what your new bill might be. And I would recommend you have your existing water bill with you when you go and use this tool. We have a bill calculator online for you to use. You can access that at venturawaterrates.net. That's again, venturawaterrates.net. I know it's kind of small in the address bar there. Under the resource tab on that same website, you can find a template letter of support if you say or feel strongly about our need to raise revenue for the water and wastewater system. You could send that in. And also a copy of tonight's PowerPoint will be on that website as well under the resource tab. So I encourage anyone who's interested in calculating what their bills might be once new water and wastewater rates are implemented. They can use this tool. It's very helpful. I have found it very useful myself. In addition to the rates, one thing that's changing is the tiers. And this is, I should say, recommended to be changed by the Water Commission. And as Susan said, the City Council will be hearing this on March 22nd. So today we have a 4-tier structure. And this is only for residential customers, does not affect anyone else. This is just purely for residential. And the concept of tiers, if anyone's not familiar with it, is the price for the first unit of water that you buy is cheaper than, say, the 15th unit of water that you buy in a given month. And so today, for the first unit of water that you buy, that price is $2.77. As you go up the chain and you go all the way into tier 4, which is rather excessive use, that's $7.73. Again, each unit is equal to 748 gallons, or 15 bathtubs full, if that helps you put that in perspective. This is what the Water Commission recommended we move to as part of the new rate design. And I'm going to drill this in a little bit more in the next slide, but the one number I really want to point out is that tier width, 0 to 6 units for tier 1. And that has a price of $2.92. You may recall on the last slide that our tier 3 started at 15 units. That is proposed to be started at 12 units. So you'll have twice as much bandwidth in tier 1, but you'll enter tier 3 sooner for those people who use quite a bit of water. I'm going to show this side by side on the next slide. So here again is our current 4-tier system, and down below is the proposed 3-tier system. And again, I'm going to point out that first cup of water all the way to the left. So in our current setup, your tier 1 only goes from 0 to 3 units. So that band is pretty narrow. And it's at $2.77 per unit. On the proposed tier structure, that tier width goes from 0 to 3 and it doubles to 0 to 6. So you can, if you're a resident who is very water conscious and tries to be frugal about their water use, that person would have an easier time staying in tier 1. And what we hope is that more residents are able to avail themselves to that lowest cost water in tier 1. It'll be much easier to do so under the new proposed rate design. The other thing I want to point out is that the price point only went up 15 cents, from $2.77 to $2.92. So for those low water users, they could see their bills affected very minimally, in consideration that they can stay in tier 1, and that tier 1 price went up very nominally by 15 cents. One of the goals that the Water Commission set out, and Jim, who's on the line, will recall this, is one of their goals was they wanted to make water very affordable for even our lowest income users. And this is probably the single best way they were able to accomplish this goal, is to expand that tier 1 width from 0 to 3 to 0 to 6. It's a subtle change, but it has tremendous impact on people's ability to stay in the lowest cost water group. We did some analysis on every single bill that was generated over the past year or so and ran that against the new proposed rate structure to get an idea of, well, who would these changes really affect? And what we found was over half of our residents would end up in tier 1. They would end up in that 0 to 6 category. And that is great news for anyone that's a low water user. They'll be able to avail themselves, the majority of our residents will be able to avail themselves to the lowest cost water, and that's really good news. And then on the other end of the spectrum, we found that only 13% of our residents were affected by that tier 3 water price. I'm going to shift gears real briefly. This is my only slide on wastewater and the changes that are proposed to the City Council. and this is kind of a in-depth topic. I'm gonna try and keep it high level, but today you are billed for wastewater use on something called a sewer determination period. It's a long phrase that just means we take a look at your water usage between the months of February and April. And we use that 3-month period as a proxy to bill you for the remainder of the year. And the logic there, in case you're wondering, well, why do you use February to April? The logic is during those, I'll call them wet winter months, even though we know that some winter months aren't all that wet. During the wet winter months, we would presume that you're doing less outdoor irrigation so that all the water that you're using, or most of the water that you're using, I should say, is going into the sewer system. And so that's the logic that say, okay, well, if they used 5 units of water in February, that was mostly used indoors. Therefore, of the 10 units they used in August, 5 of those must be for indoor and 5 of those must be for outdoor. Again, it's an approximation. It was the best option we had available to us at the time, but that's about to change. And the reason for that is we have a new metering system that some of you have seen implemented in your meter box in front of your home. We also have a new billing system, and those two in tandem have allowed us to move to actual volumetric billing for sewer. So our proposal is to get rid of the sewer determination period, because it can be confusing for some, and move to just a volumetric basis for billing for sewer charges. And what that means is, say you use 10 units of water in a given month, we assume that a certain percentage goes outside, but a certain percentage ends up down your kitchen sink, down the toilet, down the shower drain, and into the sewer system, and that's what you get billed on. Again, it's an approximation, but it's a much more accurate approximation than what we've had in the status quo. So in addition to these changes to the rate design, the rates themselves, and the structure, you'll also see some changes to your bill itself. It's going to be a little easier to read, and it'll come monthly instead of bi-monthly. And I know that for some of the comments I've received is, well, I budget my household on a monthly basis. It'd be easier for me to handle this if it came monthly. That's something we plan on doing come July. And again, this is all in the name of transparency and making sure that our ratepayers know what they're paying for when they get their bill, and it's not a complicated or overly confusing process. So with that, I'm going to turn it back over to Susan, who's going to wrap up the rest of our presentation.
All right, thank you, Akbar. So next up is really, what are we doing to invest in our water and wastewater future? Next slide. So there's key areas of investment and why our rate changes needed now. We have, as I mentioned before, we have to look at our future water supply, and the next couple slides I'll talk about where our water supply is today. We need to improve our water quality, meet regulatory requirements as well as some legal mandates, and to continue operating and maintaining our aging infrastructure. You've probably heard of main breaks, or maybe experienced one where you had your water shut off for some time. We have people who need to go out and fix those, put them into the capital improvement program for new pipelines or replacement pipelines. We have over 50 water and wastewater projects in the pipeline, if you will, in the plan. And so these are significant priorities that we need to get done. And again, these are capital improvement projects, but we also have just daily operation and maintenance of our system. Next slide. So this is a list of some recently completed capital improvement projects. I just wanted to kind of give you a little list here. Again, these are some that are recently completed, and we have ongoing ones daily, annually. So a couple slides here will kind of show you what's going on in the field. Next slide. This is just a photo that shows of our Seaward and Poli booster pump station. We're doing some upgrades to the pump station. A lot of people don't even know that we have several pump stations, and as you can see, they're pretty large and they're costly. So we need to keep updating and maintaining these pump stations. Next slide. This is our digester improvement project out at the wastewater plant. A lot of people just kind of take for granted when you turn your tap on or flush your toilet. We have to take care of that for you, and we're happy to do that. So there are upgrades that need to be done. The digester, as you see from these tanks here, it's kind of what we call the guts of the wastewater system, and cleaning up that wastewater for you. Next slide. Mound well number 3. So we have new wells going in. A lot of our wells are aged. They last around 35 to 40 years, but we do need to drill new wells in order to get our water supply and have our redundancy. Next slide. Some of you may have gotten your new meters. These are the meters that Akbar mentioned. So we have about 80% of the project complete, and this meter upgrade is really giving our customers a lot of more information. So you can go into a portal, and there's again information on the website. You can see when you're irrigating, maybe there you have a leak. So it's been really helpful for us and hopefully for our customers too. Next slide. And just recently, I'll be talking about Ventura Water Pier in a little bit here. We have our ocean outfall that is underway. We have a geotechnical drilling that happened probably, I think, 2 months ago. A lot of people ask about, when is this drilling going to happen? It happened about 2 months ago, and a lot of people didn't even realize it. If you go out there the park today, again, this was just some preliminary drilling and information, some core sampling, so we can begin our design on the project. This is in Marina Park. Next slide. And one of the things you don't see in those pictures, of course, is you see the construction, but you don't see all the staff and the laboratory analysis, the staff that works with the Water Commission, with our other departments to really keep our systems maintained and ongoing. In this slide, I want to talk about our water supply challenges. As many of you might have heard, we're in a drought. We've been in a drought for several years, and we really appreciate our customers have cut back around 20% or more. They've done a great job of conservation, and we really appreciate it. Haley Matsukawa, who is our outreach person, she's done a great job on getting grants and helping out with a lot of our water conservation that hopefully you guys have taken advantage of. And if you haven't, again, our website has some good information. Going back to water supply, we have 3 groundwater basins that we pull water from. We have Lake Casitas, Ventura River, but all of these are going to be decreasing in the future. We have climate change. Our Oxnard Basin, we anticipate a decrease of up to 50% by the year 2040. We have our Ventura River litigation. Lake Casitas levels have been going down. The good thing is we've diversified our supply portfolio. So if one system is down or we don't have as much water supply, we can utilize other water supplies. We will not run out of water. I know people have heard that before. We can pull more allocations sometimes out of different groundwater basins. And again, we have a diversified supply portfolio, so we want to continue operating and maintaining those. Next slide. So some of the new capital improvement programs that we're working on. Ventura Water Pier is going to recover and treat our wastewater and reuse it, and I'll talk about that a little bit more. State Water Interconnect project, again, is going to give us water supply reliability and better water quality. It's really helping with disaster resiliency. And again, I'll talk about it in the next slide here. We have our east to west water line interconnects, and what these are doing is there's actually 2 separate projects, and it's going to be able to pull water from the east side to the west side. Say, for instance, Ventura River is there's continued drought. We need more water to the west side. It's really bringing clean water reliability throughout the city system. And then we have several wastewater facility upgrades. Our wastewater treatment facility is very old, and we're replacing aging infrastructure there. Next slide. So again, water supply, I want to talk about State Water Interconnect project. This is going to basically provide us with water when our other sources are down or depleted. We are working with Cayugas Municipal Water District, Casitas Municipal Water District, and United Water Conservation District on the 7-mile pipeline. It's now in permitting and design. It is taking us a little longer than anticipated because with COVID, some of our permitting agencies are having issues with getting stuff done a little more efficiently, but we are working on our regional agreements. They're in process, and we hope to start construction in 2022. We are working on pre-design right now. Next slide. And then Ventura Water Pier Project. If you haven't heard about this, we have lots of information on our website. We are basically going to, right now, your wastewater goes into the Ventura Water Reclamation Facility. We recycle about 3% of that, goes to the golf courses, as well as some irrigation commercial users in the area. It's going to be then going to the Advanced Water Purification Facility and injected into the Oxnard Plain groundwater basin, and then we'll pull it out and bring it up to our water conditioning facility, probably at the Bailey plant. Next slide. There's been a lot of talk about Ventura Water Pier and the costs of Ventura Water Pier. And one of the questions we get often are, well, our rates are going to go up because of Ventura Water Pier. They are going to go up because Ventura Water Pier project, but if we did not do Ventura Water Pier, we would be doing something else. We've got to improve our water quality. So if we did not have our Advanced Water Purification Facility, that's part of the Ventura Water Pier program, we would need to upgrade our existing facilities. We have 3 treatment plants, and we would probably need to upgrade at least 2 of those. So those would be costly. For each of those, we'd also have to have a brine line and outfall, like we're having for the Ventura Water Pier project, which is going to be down by the coastline. So we would again need to build an outfall and brine line no matter what. And in a sense, this is going to help us meet our legal mandates. So instead of discharging to the estuary, we're going to be able to reuse this water for water supply needs that are required. And if we didn't have this water supply, we would have to go get new water supplies, maybe from the state or other sources. There's not a lot of sources out there. Desal is a lot more expensive, and it's harder to do. Right now on the Santa Paula Basin, they are selling water rights amongst themselves for $20,000 an acre foot. So water is not cheap, but this is a program that really meets a lot of our objectives of improving water quality and meeting legal mandates and addressing our water supply needs. Next slide. So again, we need responsible investment now because of our water supply. We do not want to build a moratorium. We want to be able to make sure our economics continues. It could result in higher future rates if we don't have rates now to help out with these projects, because instead we'll have expensive upgrades to our other facilities. It's going to be a lot more expensive, and we won't meet our regulatory requirements. So there'll be legal fines and fees that we need to pay. And again, we have aging infrastructure that we need to continue, without these, instead of having a lot of costly repairs, we can get into compliance and do new projects. Next slide. So the next focus of discussion is what's next? What did you expect? So the next slide, please. Going through the timeline, I mentioned it before. So where we are today is we're giving presentations to community councils. We're going to go to the Chamber of Commerce. We're also going to several other places that maybe there's not a community council, but groups want to know about. And if you know of any other people or groups that you think they might want us to talk to them about, please put it in the chat and we'll try to set up a meeting with them. So right now we're planning to go to March 22nd. We're going to City Council with the Water Commission rate recommendations. Next slide. And again, we want you to stay informed. If you have questions or concerns, please reach out to us. You're part of the solution. We want to be able to continue providing you water and wastewater services to the best of our ability and to really help the vitality of the community. Next slide. And we did go over, these are 3 kind of main questions that we get a lot. How does new development impact water supply? Akbar is going to talk about that in a minute here. How does the city ensure rates are fair and equitable for low-income customers? And I think there's something in the chat about how do we do our tiers, and maybe that kind of relates to that. So Akbar can talk about that. And I just mentioned about our rates going up because of Ventura Water Pier project. Again, they're going up because of not just Ventura Water Pier, We have several projects in our community plan that we need to design and construct. So Akbar, do you want to go ahead with the first question?
Yeah, I'll take that one. As Susan said, we get this question often, particularly because as you drive around town, you see, new projects popping up, and water scarcity is often on our minds. It's important to remember that new construction pays for new water. Either one of two ways. Either that project is bringing water to the, excuse me, they're bringing water to the negotiation because they have rights that they're bringing with them with the land, or they're paying the net zero fee. And for any new project, the net zero fee can be costly, and that fee goes towards creating new sources of water. The state has told us that we have to zone for new housing, and that a lack of water is not an excuse to get out of it. I think most of us know that there's a housing shortage, there's a housing crisis, if you will, and housing development is one way to address that. In fact, the only way to address that. The other last point I'll make is Ventura, where it is at in its mature city stage, we're not really building big sprawling new subdivisions anymore. I think what you're seeing is probably more infill. And what that means is those new housing units that are going up are probably using little to no outdoor water. Almost all of their water needs are being used indoors because they're either condos, townhouses, apartments, those kinds of housing units that just don't have big sprawling yards. And lastly, the new building codes mandate that our new construction is a whole lot more efficient than, say, something that was built 40 or 50 years ago. So new development does impact our water supply, but they are bringing new water to the table.
All right, Susan, and do you want to and you and Akbar want to just look at what's on the chat line and try to answer those questions?
Sure, we can maybe go through those. Or Haley, you want to take a shot at those, and have you trying to look through them here?
I'm trying to, there we go. Stop the share, there we go. Haley, I can't hear you. No, not yet. And Haley, if it's okay, well, I can read these out if you're having trouble connecting.
Yeah, and just so you know, we're at 8:35. We're a little over our time already, but these are really important questions. So let's try to get to as many of these as we can, but maybe in 10 minutes. Okay,
we'll do just that, Mr. Long. From Eric, are your average rate comparisons based on the average weight or equalized for rate based on use? How much is outdoor water climate taken into consideration when comparing neighboring jurisdictions? Okay, for Ventura is not the same. Eric, and for the group, the comparison was just very simple. We didn't take into consideration, well, climate is hotter in Thousand Oaks or Simi Valley versus Ventura. When the water passes through your meter, we have zero idea how that water is used. You could choose to skip showers for an entire month and water your lawn. We wouldn't know. Your family might know, but that's about it. With regards to the first question, the average rate comparisons based on the average weight or equalized for rate based on use. And Eric, if you're still around, I'm not quite sure what you're asking. If you're able to clarify.
Apologies, yeah, that's a little confusing. Sorry, I was just asking, you were comparing us to other jurisdictions, and was that, I think you kind of answered it in the back end, that are you taking the same amount of water and applying other jurisdictions' rate to it to compare, not just an average bill of a single family in Santa Barbara versus
Correct.
Ventura? Okay.
Thank you for clarifying. I'm comparing 9 units of water, which is our average, and I'm assuming everybody on that chart had 9 units of water.
Thank you.
Yep, good question, thank you. Let me go to the next question. And Dan, I'm gonna try and get to these as quick as I can. From Karen, is it is it being recommended to increase the base charge? This is the fixed portion of your bill, I assume, Karen, is what you're referring to. That is going up, and I believe right now we collect roughly 27% of our revenue off the fixed charge. That will still be the case. That will also go up by 7%, roughly. I'll keep going here. From Sherry, how are the tiers designed, by number of people in the home or by lot size or something different? That's a great question. The tiers are not designed by the people in the home because they are the same for everybody in your customer class. So you might have 5 people in your household and your next door neighbor might only have 2. You two will have the same tier structure. Under the proposed rate structure, you would both have that 0 to 6 tier 1 rate structure. So it does not change based on the size of your family or the size of your home. It's consistent across everybody in the residential class. From Kate, it looks, or I skipped over Eric again. How does Ventura stack up against our neighboring jurisdictions for average water use for single family residential? That's a great question, Eric. I'm not sure, but we could take a look at those numbers, and most agencies have this in their urban water management plan, which we are required to do every 5 years, and most agencies our size are required to do every 5 years as well. I don't know off the top of my head. That's a good question, though.
That's fine, thank you.
I would assume that they're probably pretty near us. If you go over the grade in East County, I would expect the number to be higher, just because of the climate, and probably a higher percentage of single-family residential homes compared to multifamily or other dense uses. From Kate, it looks like the current tier 4 users actually see a reduction in their charge of over $1 per HCF. Before I go on, let me address that one. Yes, they will, but the tier 3, under the three tier structure, you enter that highest cost water a little earlier. Under the current tier structure, you may recall you hit it at the 15th unit. Under the proposed 3-tier structure, you'll hit it at the 12th unit. But yes, that absolute highest cost water is coming down by that amount. Also, will there be restrictions on how water can be used / abused? The cost of water isn't an issue for most people. Water is worth more than what's charged to us. I may call on Susan or Haley since they know more about conservation than I do, but I believe this changes with the drought stages that are in effect. Is that correct?
Yes, so one of the things we're doing is we're working on our urban water management plan because it is due this next year. And with that is also our water shortage event contingency plan. So the Water Commission is looking at that, both of those, and that will bring us into our drought stages. And one of the things they looked at is, what are the restrictions now? So there are different restrictions. Those are going to be changing, and we're working on those right now as we go through with the Water Commission. So we'll have better information. The existing information is on our website.
Thanks, Susan. Another one from Eric. Are there any plans to expand reclaimed water supply in the city? And Susan, you know all about this. I'll let you answer that one too.
Yeah, no, we do not have any. The only plans are in the auto center area. We have a little expansion there just for irrigation. The reason we don't do that is maybe if you built a new city or a new pipelines in a city, today you would do dual plumbing systems. But because we're going to take our recycled water, we're going to continue to using it for the golf courses. But any extra water, we're going to be using for the advanced water purification facility. So it's going to be actually become part of our water supply. So just very little expansion there. And then I can take the next one. Hi, Mr. Mike Merriweather. I know Mike. How are you doing? Good to see you somewhere on here. So yes, we do have some litigation out there, and this is about rates, not about litigation. So I can't really give you any update on the litigation, but yes, we have some litigation out there. Sorry, not a great answer, but that's the best I can do tonight.
The next one is from Eric. Are you still going to charge extra to pay online versus paying by check?
So as far as paying online, I know that if you pay, I think with the Visa, then you get charged. That is something that we're looking into as a city as a whole for all our billing needs, to try to help people out more. But if you have it come directly out of your bank account, there is no charge. But yes, with the Visa, there is a charge, and we're looking into that. So right now there is a charge.
Thanks, Susan. And I believe that that charge is to recover what we have to pay to Visa or MasterCard and others like that. Although the ACH, I believe, is free, as you said. From Karen, are apartments and single-family homes paying the same amount for a unit of water? Yes. So in Tier 1, for example, both an apartment and a single-family home would pay that $2.92. The difference being is that the tiers actually expand based on the number of apartment units in that building. So if it's for a home, that Tier 1 is 0 to 6 units. But if you're in an apartment building with 4 units in there, your Tier 1 would actually be 0 to 24. So it's prorated based on, the number of housing units that are within that one building. But the actual price itself is the same.
I did have a question. I got a call from someone yesterday and wanted to know, and I'm not sure if you really answered it right. I'm not sure I got it. The rate that's going to be that 7% and 6%, is that 7% compounded annually? I mean, is it going to go up that much more? From what base? I think you did try to explain a little bit earlier, but I just want to be clear on that.
Absolutely. Thank you, Dan, for giving me another opportunity to address that. And I want to be 100% clear. That is water, and water is proposed to go up by 7%, wastewater to go up by 6% every year for 5 years. So when you compound that for the average user combined, over the course of 5 years, that ends up being over 40%, roughly 42%, I believe, when you compound that. And so, one of the reasons I think we're really trying in earnest to visit all the community councils and speak with you tonight is because we understand these rate adjustments are significant for anybody, for any residential user. And we want to make it very clear the reasons why, and we do not take it lightly. But yes, that is compounded every year for 5 years.
And I appreciate that. I think we all understand how expensive water is and how important it is to get these other, all these other pieces of the puzzle going. So it's really going to go on whatever you pay from that. At some point in time, you're going to take that, to add the 7% from the annual bill, or some point in time during that year.
So rates are adjusted every July as part of a rate study. So the first increase will take effect as proposed in July of 2021, and then the next one will take effect in July of 22. So the rates won't change for 12 months until the following July. And at which point it would go up by another 7% and 6% respectively for water and wastewater.
All right, thank you. And thank you very much for you all being here tonight to explain some of this, because several of our board members were getting calls, and we all are very concerned, but I think most of us appreciate the work that is so important to be done has to get paid for. So, and will there be, like for seniors or for people that are on fixed incomes, will there be any possible breaks for them?
Susan, you want to talk to that?
Sure. Yeah, Dan, we do have a program for low income. It's similar, it parallels with the Southern California Edison and the gas company. So if you need to apply online, we do have some information online that you can apply for assistance. And with the COVID issue also, we are looking for the stimulus packet that's going to come out. There's possibility that we're going to get some money for that to help our customers also. So we're looking into that.
All right, well, thank you very much, Akbar, Susan, Haley. Really appreciate your time this evening to explain this to us.
Thank you for having us.
Thank you. Greg, do you have, I think we have, we're going to just go to a couple of quick announcements. Cherie, do you want to go ahead and start with the first one for Loma Vista School? Go ahead.
Yes, here I am. Hi. Yes, well, this is right up the alley of the saving water. This Saturday, between February 13th from 9:30 to 11, we have our native garden Loma Vista School workday. And it's a great way to volunteer in the community. And as Sophia mentioned, it's a great way to be connected. And it's very therapeutic too, it's fun. And you learn a lot about how to take care of native plants. And we do it once a month on second Saturdays, and you'll learn about the cycle of the plants and how to take care of them at different times of the year. So anyway, you are all invited to show up at Loma Vista School. I'll put the address in the chat. Thank you.
Thank you, Cherie. And just a couple other announcements I have. The Haley Point project on Channel Drive goes to the Design Review Committee on March 17th and the Planning Commission on April 28th. There are 15 applicants for the vacancy of District 4 councilperson. East Ventura Community Council will hold a candidate forum this next Thursday, February 18th at 7 p.m. and City Council will interview them on Saturday, February 20th. You can go to EVCC website to sign up or to the city website for their interviews too. I'm not sure if they'll be televised or online, but I see Sophia shaking her head yes, and that seems like how it should be. The General Plan Advisory Committee will have their first meeting on Tuesday, February 16th from 6 to 8:30. And, you know, a lot of stuff that we're talking about, this is what impacts the future of how you would like to see Ventura, what you'd like to see Ventura become for the next 20 years and beyond. So, you know, this is how all the zoning and everything that people get upset about later when something's getting built by them or we're spending too much money for this or that. This is where it really comes together, and it's an ongoing, at least a couple year process. And lastly, there's a free virtual seminar on February 27th from 2 to 4 hosted by the Worldwide Civility Council to assist with communications in these somewhat polarizing times. And there's more information and a link to that on our current newsletter. Does anybody else have any announcements they'd like to make? Seeing none, I again thank you very much for a very productive meeting this evening. Really appreciate all of you being with us. And I think we'll go ahead and adjourn. Thank you again. I missed Peter.